portal. How are we doing? The green represents the, this, you can see the gallbladder. You can see that gallbladder has a little thin tube, yes or no? Yeah. That's the cystic duct, which is joined by a duct coming from the liver called the common hepatic duct. Now, the one from the liver and the one from the gallbladder join to form the common bile duct. So you have a common hepatic duct and a cystic duct to join together to make the common bile duct.
You're the worst. Perfect. Now you can see all the colors. It works.
You have here the inferior vena cava, and you can see the hepatic veins draining into. We'll see that there's some names for the structures and some different lobes, but right now we're doing the baby steps. Yeah, we'll do the baby step with the baby stomach. Here you see the esophagus. The red area is supposed to indicate the esophagus is irritated. It's not happy. Then you see this area right up here. That's called the fundic stomach. When you, how many of you have children? So you know about burping babies. Mm-hmm. Now, if you're going to burp a baby, and babies do need to be burped, yes or no? Mm-hmm. Do you want to tilt that baby this way? Let me ask you a question. When you're trying to get that baby to burp, does position of the baby's body help to burp the baby?
Yes.
Mm-hmm. Now, if you tilt the baby this way, is that going to increase or decrease the gas in the stomach being released?
Decrease.
Decrease it. But if you tilt it this way, do you understand why it's easier to burp? It's the same reason why, for some people, it's easier to release intestinal gas anally by leaning one way over another way. And so all of you will be thinking tonight, which way
should I go?
It's the same reason why often when you empty out your urinary bladder, you often get sound effects from the other parts. And they're saying, what in the world is he talking about? There are folds here called ruga. They go in this direction. They allow for the expansion and contraction of the stomach.
What is it called?
Ruga, R-U-G-A, or R-U-G-A-E. Now, depending upon what your home life was. For most people, when you're living at home, there's a lot more food around than when you're supporting yourself.
Oh, yeah.
Yes or no? So, what happens is when you're living at home, you're hitting the refrigerator, you're not worried about your weight. And I knew somebody who was a football player at this college, and he was eating at home 3 to 5 steaks every night.
Oh, that's insane.
3 to what?
3 to 5 steaks every night.
I would not pay for that. Like, you might own them steak.
I mean, big guys can eat a large amount of food. So he didn't get a football scholarship. Living away, what's going to happen to his stomach?
Shrink.
It's going to shrink. Comes back home, his parents remember what he used to eat, right? And now think he doesn't like mom's cooking, and the problem is the stomach just basically shrank. That led to the concept of we can reduce people's weight by reducing or stapling this very large bag and make it smaller, or we can put a band around it. Okay? And then there's other people say we can put a band around this, all to try to get you to have that feeling of being full. And you look at, and you're saying, how can you get people to think that way? Well, when you have a large girth, you can fill up that stomach. Have any of you